What if the reason you felt so alone after your loss wasn't because you were weak, but because the system was never built to hold you? 1 in 4 pregnancies end in loss. That's the documented statistic. But today's guest, Dr. Amanda Garnica, a clinical psychologist and researcher, believes the real numbers are much bigger. Because so many of us never speak it out loud. We carry it quietly. We wonder if our loss was enough. We wonder if we're allowed to fall apart. In this episode, Amanda shares what she found when she spent years researching pregnancy loss, including something that surprised even her. This conversation is for anyone who's ever wondered why something this common still feels this invisible. This is the conversation that should have been happening all along. Let's get into it. Welcome to the podcast, The Intersection of Pregnancy Loss, Fertility, Trauma, and Purpose, having the conversations that should have been happening all along. Today, I have with me Amanda Garnica. Amanda holds a PhD in clinical psychology with an emphasis in integrating. Her clinical practice and research focuses on pregnancy loss support, working to destigmatize this profoundly human experience while creating compassionate pathways for healing within the community. Thank you so much for joining us, Amanda.
Thank you so much for having me here. And again, it's an honor just to talk about the pregnancy loss and pregnancy loss community. And that is why I decided to research pregnancy loss. In graduate school, they offered me an opportunity to research anything I wanted to research. And so I jumped on it, and it started with my thesis. And I was like, what do people think about pregnancy loss, men, women, and how would they respond to it? Because I myself had experienced the loss, and I was just searching for questions, searching for answers without having to say, I need help. So taking that kind of step back approach and asking myself, what is the research saying? And then that catapulted me into my dissertation, which focused on looking at men's experiences with pregnancy loss, looking at both the quantitative data, what the numbers have to say, as well as the qualitative data. What isn't being said yet? What isn't yet been recorded in the research? And it just led me on this journey to better understand my patients, but also better understand my own experiences with pregnancy loss. Yeah, and I think the main takeaway from research that I always held in the forefront is if it's not documented, it doesn't exist. And with pregnancy loss, people don't talk about it. The statistics for documented pregnancies is 1 in 4 pregnancy losses are going to occur, but the numbers may be bigger just because it's such a stigmatized topic. If people don't come forward and say, hey, I'm pregnant, or hey, I think I'm having pregnancy loss to their medical providers or to just people in general, then it's not documented. And if it's not documented, then researchers, providers, whether they be medical or mental health providers, they can't really do anything with it because there's no data to support that there's a need.
Exactly. And it's funny that you said that with when I did you were going down your medical degree, I was going into coaching courses, but I did the same thing. There was an opportunity to do a research assessment. And I was like, if my whole business is going to revolve around pregnancy loss, because that was my experience, I might as well do a research assignment on pregnancy loss. It ended up being quite a large response through that research assignment. And it was literally trying to understand the gap and if there was someone who was a specialized care person, supporter, medical professional who understood pregnancy loss, would that be someone that the bereaved mothers would be seeking? And
Mhm.
it was just crazy how many women were still going through that experience and feeling isolated from the medical field, from society, from community, and not having the support that they needed. But then, like we spoke about just before we jumped on, like you said, the statistic is like 1 in 4 pregnancies end in loss. So that is, like you said, the documented statistic. And yet there is so many women who are going through this at home that aren't going and seeing anyone for it, that is missing from that statistic. And like you said, again, then it ripples out into the medical professions that can't then use anything other than that data because that's all they've got. So it's not quite giving us or the medical field or mental health professionals, everyone in that space, the full picture of how much this experience is impacting women's lives. And like you said, men too. What was it that came out of your research that felt surprising to you or validating? Just like, of course, this is what I'm finding.
For sure. A lot of interesting stuff came out of it because I did a mixed methods approach. So the numbers were surprising. I validated a scale, the short form perinatal grief scale. It's a scale that was originally intended for mothers who have experienced pregnancy loss, but I used it on the male population and it validated and it showed its reliability that yes, like this is an appropriate scale to use for men who've experienced pregnancy loss. So that was helpful to know, hey, this is another tool that mental health providers can utilize when working with this population, whether it's just the woman who comes in, the man that comes in, or if it's a couple, so they can understand, hey, how is this impacting whoever's in front of me who's experienced a loss? The other thing that was surprising was men aren't really known for engaging in research, especially something so stigmatized or traditionally seen, I'm using air quotes, as a woman's issue. Pregnancy loss isn't just a women's issue, it's a everybody issue. And by having a lot of men participate in my research, I had about 98 participants and about, I think, 60 participants who did the qualitative portion of it, which is a big number for qualitative research. Initially, I set my limit at 12 participants, but I just kept getting responses. And I was like, there's a lack of research within men's experiences of pregnancy loss. So I'm like, might as well. And my committee fully supported me. So I was just shocked at how many men were willing to share their experiences with it. And within that questionnaire, I allowed a portion to just say, hey, what do you wish mental health professionals knew? What would be helpful for other men who may be experiencing this? And just the vast amount of support that they had of saying, this is what we need, or this is what I hope to see in the future, or just them asserting what they need. Because again, the research was just focusing primarily on women or on couples, and just allowing the men to talk about what their needs are. That was very interesting, but also very helpful because I was able to integrate that into my write up and say, hey, future researchers, future mental health professionals, these are things to consider when working with this population, when working with these demographics. So I thought that was really fascinating, interesting. And I got a couple of positive emails from the participants of them saying, thank you for allowing me to participate, or just, this is needed. Because thinking back to what you mentioned of like you had a lot of participants, I didn't at first. My data collection took me about 2 years. I had to extend my IRB and I did online recruitment. I did every social media networking thing you can think of. I was banned off of a couple websites, which was really interesting. But I understand that sometimes those websites are meant for a closed group or they're a set mindset of going into a support group, even though I reached out to like the admin, but it was just very interesting. And then I found a lot of helpful disengagement through in-person networking and flyering, which I feel like is a lost art nowadays. I was traveling from the East Coast to the West Coast for my internship, and along the way at gas stations or random stops, I would meet people and I would say, hi, my name's Amanda. I'm a researcher. I'm doing my dissertation on men's experiences of pregnancy loss. You're a man. Would you have ever experienced pregnancy loss in your life? If so, here's my flyer if you're interested in taking my survey. It's about 20 so minutes. And I got a lot of helpful, whether the participants or the men were like, I haven't experienced it, but my brother or my uncle, and I can pass this along to them. So just knowing that word of mouth and snowballing methods still works. It was really fascinating. And I got to meet a couple different wonderful folks who are in the pregnancy loss community as either researchers or just other organizations who did spread my research and flyers. So that was really nice too, just to know, hey, like I'm not the only one interested in this. There are more researchers who are interested and who want to help this community.
To be honest, I think my first research assignment was a fluke because I've tried other research assignments since that didn't get the same engagement. Just to at least have that first one that did really just gave me a good understanding. And it just to show also that support is needed in this space. There are people that
Mhm.
need to be in this space that are outside the medical field because more often than not, the women or the men don't get referred on to anywhere that is going to actually help them move forward. But to be able to interview the men is incredibly valuable because the women are obviously going through isolation and the stigma of pregnancy loss. Not a lot of men are actually willing to do that, but to get a huge number and to get them to also go through that next phase of your research as well, because there is a lot of stigma placed around the male. You have to hold it all together. You can't be impacted by it. But they do. They absolutely are impacted by it. They're watching their partner go through everything that they're going through. And there is even less support for men to be able
Mhm.
to move through what they're going through because it doesn't look the same as what a woman is going to need.
And that's what some of the emerging themes I actually noticed were the self identification of, okay, how do I identify with this pregnancy loss since my wife, my spouse was pregnant physically, they were carrying the child and they may feel more comfortable calling themselves the mother. But I, as a father, what the participants were saying is I didn't get to hold them, I didn't get to see them on a sonogram. So how do I then self-identify? So there was a little bit of ambiguity between that. But some men were like very definite, no, I'm a father. I'm a father to an angel baby. I'm a lost dad. So just being able to add words to this and having the privilege to document that in my research was something that I found very valuable because there had not been any words to that before. I was like, how do men identify? And then what are their needs of the community and the outreach? Again, since they were thinking or they presented, I didn't physically carry this child, they didn't physically see them. What do I need help for? Or what are some other secondary needs that I need to focus on if there are living children in the household? I have to go to work. I still have to pay bills. There isn't bereavement leave if they're dropped in to offer it. So having then that, like you mentioned, there wasn't that support for them because they physically or they felt like they weren't entitled to that support, even though they very much so are.
Yeah, they really are. When I first started supporting lost mums through the healing journey, there was often a lot of questions that were coming. Where does my partner go? How can he get support? The thing is, like you said, not a lot of men are going to put their hand up directly, but it could be when we are, I know when maybe something is more easily accessible for men, more available in the community, there'll be less stigma in terms of, oh, I can put my hand up for that, or I can go to that thing, as opposed to the indirect channels of getting someone else to ask, I see my husband struggling. How can I get him support? There is support for men, but even in doing the work that I do, I haven't come across a lot. So there still is, for women as well, there's a huge gap, but for men, even more, the gap is
Mhm.
still really large there. Is there anything else that came out of your research? I know you really strongly advocate for people to actually participate in research campaigns so that we can, it's not even just about you going through it. It's about, okay, now this is my experience. What I'm going to be doing by participating in this research is going to now further help professionals, help other people, other women, other men that are going through it as well.
I think just continue to talk about it. We don't know who's listening. We don't know who might listen and say, oh, this reminds me of somebody or somebody else. So I think just talking about it, me and my husband are very transparent about our pregnancy loss situation. When I was pregnant with our recent rainbow baby, his family was like, "Oh, like that was quick." And we had to let them know we had a loss before that. And then that I shared that at our baby shower, which was odd, morbid, but at the same time, very much like me. I'm somebody who doesn't shy away from a difficult conversation. I'm somebody who will talk about the stigmatized topics, but offer information and grace and support. So, talking about that and sharing it with our families of we've had a miscarriage and that this is a very different pregnancy than maybe what we expected. And then the family members just slowly opened up and talked about, oh, we actually have had pregnancy losses too, and we didn't know that. Or a couple of my cousins are like, oh, actually, me too, or it's common in our family, or this. So just you never know who's listening and you never know what somebody's experiences are. So by just talking about it with an open mind, open space, and just trying our best to not pass assumptions along because we don't know if it was easy or if it was hard or if it was difficult or what that may look like for the person who's pregnant or the couple that's pregnant. And that's also something that kind of came out from some of the themes as well of, hey, just talk about it, whether it come from this is my experience or this is what the research is saying, just come and talk about it. And I'm slowly feeling more comfortable talking about it from like a social media standpoint. I submitted to a couple different conferences. I submitted to the Pennsylvania Psych Association talking about like words to appropriately use when talking about pregnancy loss and pregnancy loss couples and families. I submitted to the PA Psych in 3, which is basically 3 minutes of me talking about my research. And I had to push myself to talk about it. I had to push myself to press the submit button. I had everything done. I had my presentation, I had my PowerPoint, I had my images, but I recognized my own internal voice of this is silly. Maybe nobody wants to hear about it, or maybe this is just going to be so morbid they won't consider it. But I have to look at it from a very humanistic approach of this is a human event. Other humans are experiencing this and other humans need help and support. And I have such a privilege to have the education I have, to have my lived experiences, to have my clinical experiences, to say that, no, I know something about this. I should say something. And maybe me sharing this information can help somebody else, whether it be right there in that moment or whether that be many moons from now. So that's something else to take away from the research too. Just push myself to talk about it as a professional, but also as a human, because sometimes you can't separate the two. And I recognize that in my clinical practice, and I recognize that in my research as well. When I was at poster presentations from this past year, I had people ask me, like, why pregnancy loss? Why did you research that? And a common saying in research is an extension of me search. It's something that's meaningful to me. And I have just been so incredibly lucky to have supervisors who support me. When I told them I wanted to do pregnancy loss, they were like, are you sure? That's a very kind of niche population. It's a very closed off group, very protective of each other. And I was like, I understand that, but it's needed because there's not a lot of stuff that I am finding in research to help best support this population and those who are impacted on different levels. So I think that is also important too.
Yeah, and the more we can speak about it, the less closed off people will be. So yes, it's coming across that way right now. And even when I started, I felt like it was a really hard nut to crack. Like it was a really difficult place to come into. I think the more we provide these safe spaces, the more we provide the research, the more we start to really shift conversations, the more we can open that up because it is a niche in terms of really specific population and topic, but it's not small in terms of the numbers of families that are going through this, women that are going through it, men that are going through it. Like
Mhm.
there's millions of families that are affected by this, whether it's miscarriage, stillbirth, like all of it. And yet it is still so stigmatized, and still, like you said, that just that mentality of, are you sure? Because it is a closed off community, but it's only closed off because there's no safe way to speak about it. And because women are silenced from
Mhm.
the doctor's office, from the medical system, when they leave the hospital, they don't get the validation. They come home with trauma. And of course, if they're not going to get the support that they need in those moments, they're not going to verbalize what's happened because they are traumatized by it. And they're not going to talk about it to someone who doesn't understand on the other side.
For sure. Yeah. And that was something that kind of got me in those groups. I would talk about, hi, my name is Amanda Garnica. I've experienced pregnancy losses, multiple pregnancy losses, and I'm a researcher. This is what I'm researching. This is why I think it's important. This is part of not only your community, but my community as well. And like, I want to help and support us, and just like leaving it there. And of course, I've got people saying, don't intrude this space because it is so sacred. It is a safe space. So I was like, I want to respect that boundary. So I'm like, cool, I'm not going to push. But then I would get people to reach out with me and actually, I want to engage, or how can I engage? So they would follow up. So again, it's just talking about it and allowing space and not personalizing it. Because to personalize it, when you get feedback from reports or from participants, whether it be more so on the negative side of things, it can be heartbreaking. I took a little break from my dissertation research because of the feedback that I was getting. I had a participant just blatantly say that I was just not helpful for the community. I was being a culture vulture, and all these things are very hurtful because I knew authentically I was coming from a genuine place, but I only could think about how has this person been impacted, and I'm so sorry that I made them feel so uncomfortable and so unsafe. And how can I adjust my approach so nobody feels like that? I went into psychology and mental health because I wanted to help, and that's still authentically true. And just asking my supervisors, my mentors, of like, how can I do this from an empathic point of view? How can I just do my best when going into situations and not take it personal? And it was just take it a day at a time. You don't know what that person's going through, and just always offer that open end. So that's what I did moving forward, is like, I cannot personalize this. This is important. Everybody's voice is valid, especially when it comes to loss, and it impacts people very differently. So just holding space for when people are ready and willing, and offering their resources and support that I know of. And if I don't know, then I will ask somebody, and I will find somebody to offer help and support. And that's also what I love about this community too. When I would host groups on grief and loss, with pregnancy loss, just going into it, and I would say something, I'd open up, I'd let them know I'm a therapist, I've experienced pregnancy loss, but this group is not about me. This group is about these experiences, and I have my personal experiences, and I have my research, and I have my clinical experience, but how can I help you right now in this moment in this group? And then I would just let the group do what the group does, offer support to each other. And if I didn't know the answer, I'd reach out to the group and like, what are your thoughts? And if we didn't have answers, then we would just sit in that moment and reflect. And I would go and ask my supervisors, like, okay, I need help. Like, how do I find this? How do I offer them resources and support? Like, they're leaving soon. Who can follow up with them? So just making sure they're getting what they need, because they're saying, this is what I need. And it takes a lot of inner work and a lot of, okay, I'm ready to ask for help and support, whether it be women, whether it be men, whether it be couples who've experienced pregnancy loss, because it's just not talked about. But again, the more that we talk about, the more we take away the stigma, the more we take away the fear, and we're offering love, support, and information. And I think that is like the key to moving forward.
So much of what you said, it has been part of my experience as well, especially stepping out of your experience and becoming the person that is trying to do the work. I've received a lot of criticism for doing what I do, for offering to train people to become support, because a lot of the women that come through my certification are women who have experienced loss themselves. So they are turning their experience into their expertise, which is missing in a lot of support spaces. But receiving criticism in terms of that I'm profiting from people's pain. I should be a better person. And it isn't a reflection of you, it's a reflection of the pain that they're still carrying. And it is very hard, like you said, to not take that personally because you know it's coming from a genuine, authentic place of wanting to help and wanting to make a difference and changing women's experiences, men's experiences now and for the future generations. Like what we're doing now is going to change what's going to happen in the future. It has to. But it is hard to separate that from the comments that come through because you're just like, you feel like almost you're having to justify yourself to people. You're like, that's not me. I'm not like that. But it is a really hard thing to carry. And you do need people in your corner. You need someone to help you as the supporter, to help you as the healer, because trying to carry that while also trying to help and hold other people in their grief, in their emotions, in their triggers. It's a very hard place to be, but it's a very rewarding place to be. And like you said, it's when they can start asking for support, that is something that doesn't come easily when you're going through loss. Like a lot of the time people are like, what do you need? And you're like, I just don't know. But there's this moment of clarity and courage. And you're like, actually, I do know now. And to be able to put your hand up but then for you to still be that person there for them, because there's probably been many times that you could have gone, you know what, this is too hard. I can't do this. But you still keep showing up. You still keep putting yourself there in that space because you know how important it is.
One in 4 pregnancies will result in miscarriage. 1 in 8 women will experience infertility. 1 in 100 women will experience recurrent miscarriage. And 1 in 160 births end in stillbirth. Have you been wanting to make a difference in the lives of women or men who have experienced pregnancy loss because you can see so many suffering in silence, but you just don't know how? Collectively, we can change how bereaved parents can access mental, physical, and emotional support after their experience. There is a lot of women with unhealed trauma, and there is a huge gap in the current support system when it comes to bereaved parents' recovery after loss. There are too many women and men suffering in silence. The Pregnancy Loss Practitioner Certification is a worldwide, one-of-a-kind program that gives you proven methods designed for healthcare professionals, medical staff, midwives, nurses, doulas, birth workers, coaches, and angel parents alike. The Pregnancy Loss Practitioner Certification is bridging that gap. It will give you a proven support structure to follow and education specific to pregnancy loss, created by a loss mum. It is creating more education specifically for loss so that you can enhance your service and become the point of difference. Or you can create the support that you so desperately needed in your healing after loss. This is the next level of growth and expansion you have been searching for. So does this sound like something that you have been searching for? Let's explore this more together. You can head to the episode show notes where you'll find the program application, or direct message me on Instagram and let's open up the conversation in how you can use this education. You have a gift, and I look forward to supporting you and witnessing you bring your gift to the world, healing and transforming women's lives.
For sure, yeah. I accredit all of that, like what you mentioned, to having wonderful supervisors, mentors, and my own therapist too. You can't be a therapist without a therapist. I'm just going to echo that from the hilltops. And then just being as open and honest with all of those people that I just mentioned. Of this has been my experience. This is what I'm now researching, or this is not my clinical work. How do I hold my own stuff while working with my patients or my participants? But I don't want my stuff to overcome and overtake the room or the clinical environment. And then just processing that all on my own in my own individual therapy or couples therapy with my spouse. Cause it's like, hey, we're going to need this help. We're going to need this outside help. And that's okay to ask for help. Going to therapy isn't a sign of weakness or isn't a sign of you weren't trying hard enough. I like to always talk about therapy as you're checking in. You go to the doctor every 6 months, every 3 months, or when things aren't feeling right, nothing's wrong with you, but you want to do some preventative medicine. That's exactly what therapy is. And it's okay to go to therapy. Sorry, I'm going to keep saying that, but yeah, that's the main takeaway too, because that is also what came out of research. My participants were saying men should go to therapy, and I'm like, oh, this is gold. I know if I say it, it's one thing, but if a man says it to other men, specifically to other men who are experiencing pregnancy loss, I'm like, okay, great. I'm not just saying this because this is what the literature is saying. Like, these are people's real life experiences, and they're just saying, yes, this is what's needed and this is what's helpful.
Yeah, it's to hear it from people in real time, to hear them say it. It's not just you and or me or someone in that supportive role going, it's okay. Like we have been in the depths as well. I reached out to a psychologist after my loss and I had to. And it's okay. It's okay to have that piece of support in your system, in your space, but it's also okay to know that it doesn't just have to be a therapist. There are other people that can help you in your healing journey. And I think this is also where the medical professionals need maybe a little bit more awareness in terms of what it actually takes for a woman or a male to heal through this experience, especially if they've embedded trauma, especially if there's so much more that's going on that's just not talk therapy. So there's the holistic element of it as well. There was so much of it that I had to change, but I had to figure it out for myself. Yes, I had a psychologist, but then I was like, okay, but my body still feels like it's failing. My body still feels like there's something wrong. My body feels unsafe. I was in like an anxious state constantly. So there was this more of a somatic protocol I had to go through to help me. So then it was like a physical thing and a mental thing all at once. And just to have that awareness of, yes, we can refer people to therapy. And yes, that is an absolutely, it has its place for sure. But then if someone's not improving or feeling like there's something missing, then going back to the drawing board and going, okay, what else is here? What else can we do? There's still just that, I feel like there's that missing piece there as well, where one, the medical field really don't know the full extent of what women are going through, and two, they don't really know the full extent of the physical symptoms that they're experiencing as well. But also, when we're talking about the men can still experience it as a traumatic event as well, like watching their partner go through whatever they're going through. I've heard stories of the men being left alone in the hospital room with their stillborn and the men not having any support. So that in itself would be very confronting. And for the man to go, okay, now what? I walk away with this and there's nothing. I couldn't imagine that, really, to be honest, like from a man's perspective.
Yeah, for sure. And I really appreciate like the holistic approach, like that patient-centered care. Like, yes, I think my stance is like therapy, medical stuff, but also what are some more practices that the patient would appreciate or do they want to explore? Is there a need for a doula support, a deaf doula support? Is there a need for more like the somatic approach to it, like you're mentioning, of whether that be like EMDR or somatic therapy? Is there a need to be like integrated with the nature healing aspects of that? Just whatever the patient or the person may want to just try. Because I feel like this is such a vulnerable state. Like, this would be the opportunity for them to explore what would bring them comfort and support, even though it might not be a traditional medicine, whether it be like traditionally like medical, psychiatry, psychology, like what are they needing in that moment in time? And I think that's what those working with this population can do. Just really focus on what are the needs, what are the hopes, and what are the goals of the people who are experiencing pregnancy loss.
Yeah. And like you said, to also have it like you're offering a safe space to explore that, because more than not, they don't know. They're not aware that something else could exist for them until maybe they hear something that you say in a group session. Maybe this is something you could try. Maybe it's sound healing. Maybe it's something completely different outside the box, but they will then be like, okay, their mind is opened to something different, and then maybe I could try that. Maybe that could work for me. And so I'm grateful that you can hold these safe spaces for them to explore. And like you said, to even have the courage to ask for the help that they need and to go, okay, now I can proactively do something in my healing. So you've mentioned that you have group sessions. Is that your clinical setting, or is that something outside of that you do?
Most of my stuff has been through training experiences within my PhD programming. So I was primarily doing group therapy, but I've also done individual therapy and some couples therapy. Couples therapy kind of scares me, but I think it scares me just because I haven't had a lot of experience in it. But I do feel very comfortable in a group setting. So a group is three or more. So my smallest group was a group of three. My largest group I've ever had was make a group of 30, and the groups they do vary between just psychoeducation, so I'm just providing information about a specific topic, to processing, to skills groups. So that kind of varies. Or sometimes I would ask groups, okay, what are we interested in talking about next session or next week, so we can all mentally prep for that, but also I can bring in materials that would be more targeted for the participants. And then individual therapy, I would just meet my patients with where they were at that point in time. Often it was more so short-term individual therapy versus a long-term individual therapy.
Yeah. And I have, for myself, seeing a psychologist after my experience, it was helpful, but there was always something missing. And it was because she never really understood what it was that I was going through. And I think to have a therapist in you that has the lived experience, but also has all of the, obviously, the clinical background would be very beneficial for people to take advantage of. So like I said, I'm grateful that you're able to do that and to hold space for them, because for my experience, and I know for a lot of women that I've supported along the way, that has been their experience too. That general counseling and therapy has always left something missing. So that lived experience element is just invaluable. Like, to people that are going through it, they're actually sitting in front of a professional that really does get them. And I think that is the most profound thing that you can ever ask for in this experience. And then the fact you also are actively trying to change that field as well with your research and putting your hand up to be the speaker, to be out there and almost a voice for the women who can't share their voice.
In the early stages of me being a baby therapist, I'm still relatively new. I just graduated this past May, so I'm still considered a baby therapist, I would say. But earlier in it, the first 2 years, I struggled with how much do I self disclose and when do I self disclose, and just having the supervisors, mentors, and reading into the literature of like when is it appropriate. I make the intentional decision to tell my patients that I have experienced a pregnancy loss. And I always come from a space of I'm sharing this to help facilitate discussion rather than I need to share this because I have something heavy on my heart. I'm never sharing it because I want to talk about my own experiences. I want to just share, hey, this is something I've experienced. It's a human experience. And some participants, they find that helpful. And some, I would say, sometimes they don't. So I think it just like varies. Like some might find themselves comparing themselves. And I think when it comes to pregnancy loss, since it is not often talked about, there might be a misunderstanding with like miscarriages or stillbirths or ectopic pregnancies or terminated for medical losses. There is still that stigma of, is it enough? Is this enough of a pregnancy loss to share? Is my loss valid? Is it as important compared to a mother who had a stillbirth at full term versus maybe somebody who's had a pregnancy loss at 6 weeks, 5 weeks? And to that, I say that pregnancy loss is valid. Your emotions are valid. These are real experiences. And to come at it from a space of we're not going to compare. A loss is a loss. It might have looked differently compared to somebody who had the baby shower and had everything planned versus the parents and the mothers who were talking about the what ifs and what does it look like, the aspirations. But at its core, it is a mother, it is a father, it is a parent who is in pain, who has lost their child. And just honing in on that common experience for the group or for the individual session of we're not going to compare because we're all in a similar boat.
Yeah. And it just gave me goosebumps because, you know, what often can feel so personal is often so universal. Like what we're going through, we can be so consumed with what we're going through, but like you said, to its core, there's a very common thread, and it's a very human experience, and we're going to feel something. So yeah, trying to take the comparison out of it. But I love that to its core, there's parents that are hurting. You don't want to dismiss that. You don't want to downplay that. Like that needs witnessing to the fullest, to its completion, and more people out there who can understand that and can hold space for that and conversations for that. I love that you're able to do so much research in this space. I love that you're able to also show up in this space and support men, the women, the families, the parents that are hurting, and continue to be a voice in such a bigger way than most people can do for themselves. You have this clinical background, you have access to more clinical things that can change the system from the inside. And I appreciate you for all that you do. I appreciate you for the work that you're doing. And I really just want to say that keep doing it, keep showing up, because we are shifting and changing this space. And as hard as it might be, as people might say, it's too hard of a space to be in, it's too emotional, it's too triggering. You're like, but it needs the support. These people need the support so much because it is still so stigmatized.
For sure. Thank you. Yeah. And thank you just for offering me this opportunity to continue to talk about this because that is my favorite thing to do. I think the more that we talk about this, the more that we are authentic and welcome a space for just this communication, this dialogue. Again, like the work is being done. Thank you so much for having me and just continuing to have these difficult, but I would say very rewarding conversations.
Yeah. It was something that I felt like I needed in my healing journey. So I was just like, I need to create it. And I don't see that stopping anytime soon. I don't want to stop that anytime soon. So I'm open to more of these more of these conversations. And then when our children grow up, hopefully they are in a place where it is talked about openly. There is support accessible. There's referrals available, that it's not so pushed under the rug.
Sure.
So where can people find you? Do you have any open research projects at the moment or anything coming up that you're a part of? All of the things.
Yeah, I'm on Instagram. That's the only thing I have right now. It's AVG Research is my handle. I'm not a part of any research right now. I'm actually on sabbatical. I took a little sabbatical leave after I graduated, but I'm applying for postdoc positions. So I want to get licensed in California and Pennsylvania. So as a requirement, I have to have so many hours after I get my doctorate. So I'm hoping to get placed at a institute or at a organization that allows me to continue to do research within pregnancy loss. I will for sure be doing clinical work in pregnancy loss with them because I had made it very apparent this is my interest and this is what I'm going to continue to work on. So unfortunately, I don't have anything in that area right now, but for the future, I've been talking about my goals. I want to be licensed and board certified in a couple different things in addiction and clinical health psychology. And I would love to open up a private practice one day because I do firmly believe that pregnancy loss and discussion of pregnancy loss and grief needs to be continued to be followed up on. But that's all I have right now. I would love to continue doing research, but I do need to be within an organization to do so. I'll definitely follow up if I have any more research stuff opening up and I can just continue to spread it.
Yeah, absolutely. So if you do have anything that is, and at any point anyone's listening into this, if Amanda does have any research projects, I'll invite Amanda to reach out. I can also update the show notes. So that is something that we can do. We can share it on social media. So check it all out, and I will keep everything updated as much as possible so that if anything does come available and you want to take part in what she's doing, then hopefully check the show notes. If there's something there, then take part. If not, watch that space and watch her Instagram. So definitely go over and reach out. Also, if anything that Amanda has shared has resonated with you, just to, even if it's just to have a conversation with someone who understands.
Thank you so much. I really appreciate your time and this opportunity. And this was such a lovely experience. And again, thank you for letting me talk about something I love and care so much about.
You're so welcome.
I'm on sabbatical. I'm just doing a postdoc position. So my schedule is pretty open, but I would talk about anything, whatever you want, especially I feel like searching pregnancy loss while experiencing pregnancy loss, that was a gnarly experience.
Yes, I could imagine going through the motions and being in the depths of grief for yourself while also researching it. I think it could works both ways. Like you'd also know almost like what you're looking for, but trying to navigate it at the same time. Because it's very hard, like once you get distanced from your experience, how it felt and what you needed in those moments. But as you're navigating it in real time, there was probably things that you asked in your research that you probably maybe not thought of if you were so far out from it. But I could only imagine what that would have been like. And I'm just grateful that you were able to do it. You were able to have the capacity to do that for yourself, to navigate that for yourself. Just on that, actually, how were you able to provide yourself space to grieve while you were doing the research project?
I think just being open with my research committee and letting them know, hey, I'm having a miscarriage. I know I'm in the middle of data collection. I'm going to need some time before I return to it. And then when I return to it, just having a game plan of how often should I actively recruit? How often should I look at the numbers? How often should I do that? And then when I came down to the data analysis, I had a couple of my peers help me code and look through the research to find themes. Just being very transparent and writing up in the research itself of, hey, this is who I am, this is my experience with it. So being aware of my potential biases, their potential biases, and debriefing of what that means, of what the participant's saying, and maybe how I'm viewing it, how they're viewing it, and come to an agreement of this is what they're saying. And then lastly, in the write-up of the whole dissertation, there's a trustworthiness portion that most researchers or all researchers should integrate when it comes to qualitative and mixed methods research, of saying what are some potential barriers or biases that the researcher may have had. So to write into my dissertation, I've experienced a pregnancy loss, I've experienced multiple pregnancy losses, and was pregnant while writing up my data. That may have influenced my experience with understanding and interpreting the information, but these are some safeguards that I integrated to make sure that the research is what the participants are saying rather than what my emotions may be coming out or what may be happening on my end of things. So just taking that empirical research based approach from it, which as I'm talking about it, I feel like it sounds very robotic or methodical, but it actually helped me a lot with processing it. I'm like, okay, cool. Like, one, I'm not alone in this, but also two, the research that I'm providing, the data that I'm providing, it is the participants. It's what they're saying, it's what they are needed. And it gave me a little bit of more reason to continue pushing forward to write it. And then just like I mentioned earlier, just having these open conversations when I was presenting my research at conferences and people were asking, why are you talking about this? And this is why. And as you recognize that I tear up sometimes, or that my face does kind of get red or emotional, then very human experience, and something that my peers would tease me for. They're like, Amanda's always crying. I'm like, yes, I'm crying because I just feel so overwhelmed with my emotions, and I feel so safe and so comfortable to express it in this space. So I'm going to express it. So that was also helpful too, just feeling comfortable and having the spaces to talk about my experiences, both as a person and as a professional. That's what kind of grounded me and motivated me to keep going with my research.
Because you are showing up in a professional capacity, but you're having a very human response. So, you know, it would have been so intertwined in what you were doing, but you felt safe to be able to express your emotions. And I think that's what we need to also normalize, is that the emotions, they just come and they will continue to come. There's no timeline when they just magically stop. Being in the thick of it yourself, the grief would have been so heavy, but then even years out from a loss, you can still become emotional when you're talking about it. But I think just normalizing the emotion that comes with it and the grief, like you're allowed to grieve, you're allowed to cry, you're allowed to feel angry and whatever comes up, and having those safe places to be able to do that.
Mm-hmm. For sure.
Thank you. Thank you again, Amanda, for being a part of the podcast and for sharing all that you have today so openly and vulnerably.
Thank you so much too for this opportunity. Again, I really appreciate it. And I know you're doing the right thing. I'm so glad that you continue to do this. And I am so excited to hear future podcasts and what other professionals or other lost parents have to say about their experiences with pregnancy loss, because it is helping people.
Yeah, absolutely. I don't doubt that these conversations, even on a singular platform, just as a podcast, is changing someone's perspective. It's changing someone's day. It's shifting how someone's thinking about it, offering something potentially that they haven't thought about before. It is making a difference. And my mission was to, if I could only ever just help one person feel less alone, less isolated, less what I did going through it, then that was my purpose. So I feel like having the podcast, having this platform is able to do that. And if I can help one person that's listening in, then I'm doing my job. So thank you again. I'll link everything in the show notes so people can reach out to you. They can see what you're up to. But is there anything else that you wanted to leave the listeners with before we wrap up?
No, I think we covered everything. And I'm so glad that you offered this space. And I'm so glad that the listeners are giving themselves the opportunity to listen and to explore and do what feels right for you when it feels right for you. So I feel like sometimes, like you mentioned earlier, when it comes to grief and loss, there may be this quote unquote timeline, but there is no timeline for grief, for love, for anger that comes up when it comes to pregnancy loss. And whatever you're feeling when you're feeling it is valid. And yeah, you're not alone.
No, they're not alone. Thank you so much.
Thank you so much.
Thank you to all that have listened in. If this episode was valuable to you, I invite you to leave a review on Apple Podcasts, and I look forward to supporting you on the next episode.
Thank you for listening in with me today. I hope you found this episode helpful. If you did, I would absolutely love to hear from you. Take a screenshot of this episode, share it to social media, and tag me at Institute of Healing_PL. I love seeing what is resonating with you right now. If you want to chat further, I invite you to connect with me through Instagram. Head over and follow my Instagram account, send me a DM, and let's open the communication. If you want to know more about how you can be the support for others, head to the show notes and fill out the application form for the Pregnancy Loss Practitioner certification. I want to also note here that what I share within the episodes is not medical advice. If you need further support, please consult your doctor. Thank you again. Much love to you. Be gentle with yourself, and I look forward to supporting you on the next episode.